I'm standing at a crossroads in my life, facing a reality I never expected. My mother, the strong, independent woman who once embraced the world with an adventurous spirit, is slowly losing her memories. As a healthcare professional, I'm constantly grappling with the question, what do you do when your parent becomes your patient? The thought that she won't remember her life, her accomplishments, and that she won't remember me is heartbreaking. Growing up in a tumultuous environment, she became fiercely independent, and her love for adventure shaped much of who she became as an adult. She married my father right out of high school, embarking on a short journey of military life when he was drafted. She later became a beloved elementary school teacher. Her world expanded after she earned her PhD, traveling the world speaking, and spent years teaching at LSU. To this day, she remembers her time with great pride, often convinced she needs to go drive to work to finish a project, though we've had to hide her keys. I've seen so many people face the challenge of cancer in my role as a nuclear medicine professional, often being the first to witness their diagnosis and visualize if their treatment they've been going through is working or not. But Alzheimer's, it's different. No one can prepare you for this kind of disease.
Give him a kiss.
I'm trying.
Give him a kiss. He's like,
As a child, school never held my attention. But once I discovered molecular imaging, everything clicked. Nuclear medicine fascinates me. It's a field that constantly evolves, keeping my curiosity alive. It uses radioactive tracers to assess physiology, diagnose disease, and help determine the best treatments. Through theragnostics, we're now able to diagnose and treat many diseases using radioactive pharmaceuticals. Nuclear medicine provides a path to knowing how to treat, fight, and cure certain diseases. I first noticed subtle signs of cognitive decline in my mother several years ago. But her playful, free-spirited personality often led family members to dismiss my concerns. When I was younger and things didn't go according to plan, she would say, "We're on an adventure." No matter if we were eating ice cream for breakfast, which we did often, or getting stuck in the ditch, she would laugh hysterically at our reaction most of the time and state, "It's okay, we're on an adventure." Her mental decline began to accelerate after my father's unexpected hospitalization in May of 2022. One day, she couldn't remember where she parked, struggling to navigate the street she knew like the back of her hand. I had to step in and make decisions to protect her, like hiding the car keys when she insisted on driving. My father's health deteriorated. So did hers. I found myself taking on the role of caregiver, a position I never imagined. It feels wrong to parent my own mother, yet somehow it's become my responsibility. While caring for both of my parents, my focus was first on securing a diagnosis for my father's debilitating illness. Then I turned to finding the right care for my mother, someone who could understand the magnitude of her situation and my father's. Without my presence at the hospital and persistence in quality medical care, my father wouldn't have survived. Being an advocate for patients in the community has always been personal to me, but I never anticipated this role extending to my parents. No one teaches you how to be a caregiver for your parents. It's something you learn when you're thrown into the fire. I discovered many things left undone, like my mother's lapsed health insurance, my father's unfinished taxes, and overdue bills that hadn't been scheduled on automatic payment while he was in the hospital. My job became finding the best medical care for both of them. Navigating the healthcare system, especially looking for a specialist like a neurologist. If you ever find yourself in a similar situation, here's a tip. Take the 6-month appointment. but call every morning to check for cancellations. When we finally got my mother into a neurologist's office, her cognitive decline was assessed using the MoCA test. Scoring begins at 30 with levels of mild, moderate, and severe, severe being anything below a 10. My mother scored a 4.
We went outside and there was an alligator in our front yard.
Alzheimer's was confirmed, but we were left in the dark about the specifics. I pushed for additional testing, and after some back and forth, an MRI and a PET CT scan were ordered. One thing I've learned through this journey is how crucial it is for patients to have multiple scans or appointments on the same day, whenever possible. It minimizes the burden of travel, and sometimes one IV can be used for all the tests. For someone with Alzheimer's, the confusion caused by a blood pressure cuff or a needle stick is more than just uncomfortable. It's terrifying to them. March 5th, 2024. The PET scan went smoothly. After the injection of the radioactive tracer, she relaxed in a quiet room with music for an hour, and then laid still on a table for about 10 minutes of imaging. She did great, but the MRI was a different story. She was overwhelmed by the noise, confused about why she was there, and scared of the bird cage that had been snapped in over her head. I was grateful I was allowed to stay with her and hold her hand during the MRI. As she lay there trapped in the machine, I saw the fear in her eyes, and once the banging noise began, there was nothing I could do to reassure her that she was okay. After several minutes of what seemed to be torture to her, I had to make the difficult decision to stop the scan. It was heart-wrenching, but I couldn't bear watching her suffer any longer. I had already learned emotional stress escalates her symptoms, and any benefit from the MRI did not outweigh the risk for her in that moment. Thankfully, the PET CT scan provided the answers we needed, revealing the progression of atypical Alzheimer's disease. It showed decreased activity in the right frontal and parietal lobes, as well as a greater decrease in the right temporal lobe than the left, which is not a typical pattern you see in neurodegenerative diseases. A year and a half later, my mother's memory has deteriorated to less than 20 seconds. Sometimes it's as little as 5. Most days, she thinks she's in someone else's house and needs to go to her home in Baton Rouge, a place she hasn't lived in for over 50 years.
Anyway,
So what did you mean by going home?
oh, well, because there's too many things that I have at home, in Baton Rouge, but I have to take care of.
I can spend an entire day with her having a great time and laughing. I can leave the room for just a minute, and when I return, she acts as if she's seeing me for the first time. I've learned to simply go with it. When she gets disoriented or frustrated because she's not home in Baton Rouge, I've learned to redirect her attention to a different activity. Alzheimer's has a life expectancy of 7.5 years after diagnosis. It's been 10 years since I first noticed the signs in her. Through this experience, I've realized sometimes the greatest challenge in life is not about professional aspirations, climbing mountains, or traveling the world. Sometimes it's about holding the hand of someone you love as you both navigate a path neither one expected. And even in the face of Alzheimer's and the unknown, we can still find joy, laughter, and love. Our time together is running out. I know that the day will come when she won't remember me. But until then, I'll keep singing and dancing and smiling with her through my tears, all the while reassuring her, it's okay if you don't recognize this place or me. We're just on an adventure.
Yes.
Let's go on an adventure.